Hello and welcome to Level 3 Health and Social Care, Unit 301. The title of the unit is An Introduction to Health and Social Care, and the focus of this unit is about yourselves as a health and social care worker, looking at some of the roles and responsibilities and expectations of you as that worker. This week, we're just going to focus on the role of duty of care. All health and social care workers have a role of duty of care, and it's very important that you're aware of that and sort of aware of the expectations of you under that. This week's slide comes in conjunction with a workbook which you can do as you go along through the slides. There are times when you can stop and update your workbook, or if you prefer, you can work through the slides and then complete the workbook at the end. The workbook is really for your own benefit, is to consolidate all the information that you've been learning in this session. But it will be valuable for you to complete. And if you're really not sure, if you think some of the answers you've given aren't correct, you can always WhatsApp me to sort of check them out. So often at the end of our week sessions, we'll have a quiz, but this one, you're just going to do the workbook as well. And there'll be some extra reading too, but we'll look at that towards the end. Okay, so for those of you who want to work through the workbook as we go along, you might want to open it up. It is a Word document, so you can write into it, or you might just feel like printing it up so that you can just scribble your answers as you go along. It's really up to you how you feel like doing it. Like I said, you don't have to send it back to me to be marked. It's just something for your own purposes. Okay, so let's get underway. So first of all, how would you define duty of care? It's sort of something that we all think we know about. If I said to you, do you know what a duty of care is? You'd probably say yes. But sometimes it's harder to sort of explain what is the meaning of duty of care. Sometimes it's easier to work it out when you deal with sort of a dilemma or a problem, and then you sort of think, well, what's my duty of care in this situation? Really, it's about sort of having the confidence to work out problems, dealing with mistakes and conflicts. That's really at the beginning of it, and to be aware of that can help you sort of really develop yourself in your career. So by the end of this session, you should be able to understand how duty of care contributes to safe practice. And this is a stepping stone to what we're going to be doing in the next session, which is looking at safeguarding, which is looking at your learning outcomes 1. But this duty of care is a sort of an element that leads in to learning outcome 1. You will also be able to understand support available for addressing dilemmas and complaints, dealing with incidents and near misses and difficult situations. And we're gonna sort of address a little bit about equalities as well. We've talked about them they do come up in person-centered care, but we're gonna look at equalities here as well a little bit, and about inclusion and diversity. So a little bit of an overview of that as well. Okay, so we're going to start first by what is duty of care. So we're going to have a look and see what encapsulates. As I said, duty of care is a really important part of the role of health and social care. We're going to really have a look and see what really encapsulates all the main elements. So the following core ingredients are what defines duty of care. First of all, it's to have enough training to do the job. So to be trained and skilled enough to know the job that you're supposed to do. So if you're talking about a job as a healthcare worker, it means that you should, you're the place that you work at should have given you enough introduction, enough induction training. Some of the mandatory trainings usually set you on your way to a level 2, level 3. Um, those of you who are doing this are doing your level 3 at the moment, so you're undertaking the training required to do the job. The second element of duty care is knowing how to behave professionally. It's actually accepting the fact that this is a professional role and there are some professional approaches that you need to have, and you need to respond in a consistent way, really, in a way that's accepted across the board. So duty of care is something that crosses all health and social care work, and everybody is expected to approach it in a sort of similar way. And the main part of duty of care is to work in accordance with both formal and informal in-house policies and other legislation that governs your organisation and that governs the work that you're going to do. And that will be led by the policies, hopefully, in the place that you work should be meeting all those requirements. But also, it's really about thinking what are the values that you should have to be able to sort of carry out your duty of care. You should work in a person-centered way. You should always act in the individual's best interest. So it's a choice between your interest and the individual's interest. Well, those should come first. You should always keep people safe from harm, abuse, or injury wherever you can. And also, you need to focus on promoting an individual's independence. And you've got to pull all those aspects together. And you can imagine sometimes there may be some contradictions here, but you need to carry out your duty of care. You need to be able to balance these main values together. Concept of independence isn't always that easy. So sometimes it's, what does independence mean to one person? It might mean something different to another. Many of us would say it means doing things for yourself, or feeling in control, or being able to make your own decisions. Now, we do know that sometimes um, our service users maybe can't always make their own decisions. They may have dementia and they may not be able to balance the decision. You might need to step in to help. Or they might not always be in control of what's happening to them because they physically can't do some things for themselves. It's important to let them do things wherever they can for themselves, but there are times when you might have to step in and help. But it's about the way you do that. So to step in and help is carrying out your duty of care, but you have to do it in a way that is very person-centered, that's keeping their independence as much as possible, not taking things away from them. We've talked about this in other units as well. But when you look at the person-centered care unit, we'll address this in a lot more detail. There is a video clip on SKI. If you follow www.ski.org, I'll put it up for you here as well in your extra reading bit, called Practical Assistance. And that just tells you about how you can really help. But it also reminds you about looking at people's independence, reminding you that the individual needs contact with their friends and family, not just you sort of running their life as well, and a little bit about how you can use technology to help too. So have a little think at the moment. Have a look at questions 1 and 2 in the workbook. If you want to do the workbook as you go along, now's the time to stop. Look at question 1 and 2. Take some time out to complete that. You can press pause on your video, and then when you're ready, you can move on. Those of you who might decide that you're going to watch the whole video and then just do the questions afterwards, that's fine. You can do that too. But for those of you who want to do question 1 and 2 now. Press pause, do your questions, and then we'll move on. Okay, so I'll see you again in a minute. Okay, we're looking at part 2, difficulties and dilemmas. Oops, sorry. So we're sort of thinking about what is a dilemma. It can be something where you're thinking, okay, I'm not sure what to do in this circumstances. This isn't a day to day where I know exactly what the process is. We don't have a policy for this. Sometimes the service user wants to do something and we're not sure whether it's okay or not. So this is a sort of dilemma that you could be set with. You may be working in the community, you may be a community support worker. So Kevin may live at home and your job might be to go in, on a daily basis to sort of help him with activities, helping with independence work and such like. So here's our situation. He's 24. He's got a mild learning disability. He's always been protected by his parents. He wants to go backpacking around Australia with a friend who he's met at the restaurant where he works. His parents aren't too happy about it, but his brother and sister are quite supportive. So these are some questions that you could think about. You could jot down some ideas. What is the dilemma? What do you think you should do as part of your role? So have a little think. What is your role? What is your role not? What should you not do? Where would you go for some extra advice? So you can take some time to think about that before we move on. If you want to take a bit longer, press the pause button, as I said before, and then move on when you're ready. So, some of the things you might have thought of is a dilemma. Should Kevin go on holiday? Or how can we support him to go on holiday safely or unsafely? Should we stop him? Would that just sort of make it even harder for him? And for your relationships as well, he may just want to go even more. How are you going to manage his family? How are you going to support his family in expressing how they feel? How much influence do you think the family should have on Kevin's decision? If you ignore it, is it going to just make it more eager? And is he just going to do it anyway? And then maybe he might do it in an unplanned way or an unsupported way, which could have a very negative effect. Or you could help Kevin sit down, work out some of the risks might be involved. You could do a risk assessment together and work in partnership to plan how you can reduce those risks. So we try to mitigate risks, remember. We can't always eradicate risks, but the idea is to try to mitigate as best as possible. After that, you could have a meeting with some of the other people involved in supporting Kevin, including his family, his mum, dad, brother and sister, Kevin, of course, and if there's any other workers who are involved with this case, a social worker maybe, and you could all have a chat together about the best way forward. But really, it's most important that you listen to Kevin, because otherwise he could just go off and do it without you. Okay. Other support and advice you could go. British Institute for Learning Disabilities, they're great. They've got loads of ideas at helping to support people. MenCap has lots of support. They also have ways about helping people plan for holidays as well. So there's quite a lot of things to do. Some places actually provide specialist holidays for people with learning disabilities that might not meet Kevin's needs, but in this case, but on the other hand, if you sit down and all agree that because of Kevin's personal abilities, that the traveling all the way to Australia might not work for him, you might be able to find an alternative where he's supported by experienced staff. So there's lots of ways to think about it, really, but using some of the commercial websites such as Build, British Institute for Learning Disabilities, and MenCat particularly, who who are a big support group on a wide range of things, could be really, really helpful. So it's you need to start thinking about things because especially if you work with people with learning disabilities who are young, they really may want to do lots of things that you might not have expected people with a disability is actually working to do. So as you learn in your role, that you can learn with them really. Let's think now about concerns and complaints. In 2013, the local government ombudsman received 2,456 complaints about adult social care, and that's actually a very tiny number, considering there's at this time there was over 1.3 million users of adult social care in England. I'm pretty sure it's gone up since then, so there are much more users. So if you think about it, very few people tend to complain. We might need to think about why that is. Some of them don't complain because they don't know the processes. Some of them don't complain because they may not have the communication skills to do that or know where to go. Uh, Unfortunately, some may not complain because they're a bit frightened that they may lose their service or their service could get affected, or the people who work with them might not want to work with them again. So, one of our roles as part of our duty of care is to encourage individuals to be able to get their voice heard when there is something they're unhappy about. And it is about their human rights, it is about complaining when their human rights are not being met. So, if people are reticent to do it, you might need to help them, or you might need to do it on their behalf, as long as they are happy for you to do that. You wouldn't want to do it against their will. But if they want to and they say, yes, I'd like you to help me, then fine, go ahead. There's different ways that people can make a complaint. Um, there are formal channels which you can make a complaint, and these are formal services. The advocacy service, when someone can't speak up on their own, you can ask for that via social services. A PAL service, that's usually when you're dealing with an NHS issue, Patient Advisory Liaison Service, and they have a formal complaint system if you're complaining about your doctor or your nurse or anything like that. And that's easy to find out if you go on your local hospital or NHS website. There'll be a link through to the PAL system and it will tell you exactly the complaints process. You can, if your service is inspected by CQC, we've talked about CQC in other units. If your service is inspected by them, so if it's a registered care home, it probably will be. If it's a GP practice, it will be. A dental practice, it will be. So complaints can often be driven through them as well. But before you get to formal complaints, it's always worth people trying to make their views known informally. So again, if you're in a care home with someone and they might want to speak up to the manager about something they're not happy with, it's part of your duty of care role to enable them to do this or to make sure that they get their voice heard. And it could be something as just, you supporting them while they talk to the manager, or if they find it difficult to explain themselves, maybe plan it out beforehand. And you decide, work out with them what they want to say. You might want to help them write it down, or they just maybe they have communication issues and you might have to help sign with them or use pictures with them. But so it can be an informal meeting with the manager, or it could be something more formal with a more senior work person. But really, it's always worth trying to resolve it informally first. So, what are the effects of getting the complaints handling right or wrong? If you don't do it very well, the person will feel it's a waste of time. They may feel embarrassed. They won't want to, raise an issue again. So any opportunity to improve the service will get lost. If you do it well, if you support them well, and if their manager responds well, the person will feel valued and listened to, and they'll feel empowered, and they might be more willing to speak up again in the future. And because of that, the service will learn from the mistakes, and the quality of care for all will be improved. So the most important thing to encourage your service users is, if there is something they think that really doesn't work in their home, in the care home, then that they should stand up and say so. And again, it's up to you to enable that. And they might not want to do it in front of a big group. They might just want to do it privately with a manager, or they might want to just write it down, as I said. But you have to make sure they understand that the service can only improve when they raise their issues, because people will take action. So we've given a little bit of thought to dilemmas and things to think about, and the sort of dilemmas you might have. We've given a little thought to raising concerns and raising complaints. So you can take a moment now, if you're working through your workbook, to answer questions 3 to 5 to consolidate your learning. Okay, so questions number 3 to number 5 before you move on. So, as I said, press pause, do your questions, and then when you're ready, we will move on. Okay, moving on. Now we're going to sort of think about dealing with incidents. We're still on difficulties and dilemmas, but we're thinking about how we deal with incidents, and where does this lie in our duty of care? Well, mistakes can happen no matter how good a work staff you have. Most important thing is that the organisation needs to be positive and be committed towards learning from those mistakes. And so do you as individuals. As part of your duty of care for the service user, you need to be able to accept some criticism. If there is any mistakes made, you need to be able to take that and work with it, really. There's lots of reasons why mistakes happen. Stress, negligence, being distracted, being too busy, bad communication in the team, lack of knowledge for the individual who's doing the piece of work. These are some of the reasons. But as long as you're positive about them and you try to make sure they don't happen again and you do something about it, then it can be a good thing. So if a mistake happens, it's good to discuss it at a team meeting to identify maybe where it went wrong. Now, if it's a serious mistake, you may have to complete a form about an incident where they'll be asking you those sorts of questions as well. But remember, learning from a mistake can be a positive thing. Um, if you don't really address it as a team, then that sort of mistake could happen over and over again, or coming out of it, something more serious could happen. Mistakes can actually be categorized, and they are in 4 areas really. Adverse events, which is often when something that you didn't plan that happens. So you carry out your work with the best will in the world, and there's something unexpected that happens, that sort of makes a mistake happen or takes you in the wrong direction. Or errors, so not doing something that you should have done, or missing out a part of a process, or forgetting something. Forgetting to give someone their medication is probably one of the most common areas that ever gets documented. And when you do that, you must document it, because people need to know whether they've had their medication. Near misses, a situation where someone could have been hurt, but it was prevented. It's starting to get a little bit more serious now. Something went wrong, and it could have been bad planning, or it could have been intentional. We don't like to say that, but it's quite possible. Or an incident, which is a negative event, and it needs investigation because it may have caused severe harm, or was about to cause severe harm, but someone might have just got stopped. Either way, it still needs to be documented and investigated. It would be ideal to try to talk about most of these types of mistakes, but certainly if it's an actual incident, it will have to be documented. And there you will need to show some evidence of how the team has discussed, a planned outcome. Is there any changes that they're going to make? So incidents has to be documented, and your plans need to be documented. Um, but the first three are encouraged to have a discussion, really. There are some laws and regulations that help to protect your safety, and you need to look into these in some of your extra reading time. Health and Safety at Work 1974. It sounds like an old act, but it just hasn't been changed because it's kept the roles and responsibilities very clear about what employees are responsible for and what employers are responsible for. Okay, that's really, really important. So you can have a little bit of a look into that. So you know what your responsibilities are when you're working in the care home. You know what your responsibilities are when you're working in the community. And again, completing those responsibilities are part of your duty of care. Management of health and safety regulations, that's a little bit more about what your employers need to do and about the need to take risk assessments. So if you have a look at that, it gives you an idea about what your organization at your workforce should have done about risk assessment. So any risky activity should have a type of risk assessment. And that tells you a little bit about, what risk assessment should look like, really. So hopefully in your organization, you will have local policies on this about risk assessment, about, roles and responsibilities of health and safety. But if you don't, you can look into this legislation and that can help you see what should be there. Okay. And if you don't, maybe it's worth asking why there isn't anything, because it is really unusual. Finally, the reporting of injuries, diseases, and dangerous occurrences, generally known as RIDOR. And somebody might say to you, "Where's the RIDOR form?" And that's these quite serious incidents that I've identified. Those are the things that have to be. They have a very clear form that you have to complete and show what your outcome planning is. And they get sent to the Health and Safety Executive in England. Those of you working in other countries, they will be sent to the organisation. It will be some sort of health and safety executive wherever you live, or some sort of government organisation generally, because it's also the place where you report serious communicable diseases if someone gets diagnosed with something. Um, you know, and that will really differ depending on what country that you live in, what communicable diseases needed to be reported. Certainly during COVID-19 times, care homes in this country were having to complete RIDDOR forms whenever somebody was COVID positive, so they could keep so the local government could actually keep an idea of how many people in a care home had COVID and stuff like, and you know they could see the trends in the numbers going up and down. So they had to use that RIDDOR form to report that one. Controller substances hazardous to health regulations, 2002, generally known as COSH. And that really is a good rundown of the sort of chemicals and other substances that you might have around the care home, like bleaches, washing up powder, those sorts of things, which can be hazardous to some of your service users, and it needs to be looked after in certain ways. The COSH information, again, you can look this up on the internet. It tells you exactly how to look after everything. What should be under lock and key, what should be put away in certain cupboards, what shouldn't be in the service users' rooms, how you manage the clinical waste, what is clinical waste. Clinical waste is generally, you know, waste that has sort of bodily fluids on it, or blood, fecal matter, and you know how you should do those. Generally, clinical waste is sealed up and incinerated. So you've got dirty pads. You don't put them out in the normal rubbish. There's usually a special collection for them. If you have people on injections, maybe they have insulin injections, there are special procedures to you know look after the needles and the syringes and that. And they also are, they may well have a special collection, or they may well go to an incinerator, but they, again, they don't just go out with the general rubbish as well. So there's lots to think about there. But if you pop through into the internet, you can really look at COSH in detail. Very important. There might be some substances in there that you know may not occur to you how dangerous they can be for some people. We already know that there's been incidents with like small children and washing powder, which has led to the washing powder manufacturers have to, in their adverts, in their TV adverts, to remind people to keep them away, keep them sealed in a pot that children can't get into, you know, especially if you use these washing tablets to keep them away, because you know if children ingest them it will kill them. So especially if they're quite small, like babies, and babies do tend to ingest things like that because they're quite brightly coloured. Um, so just lots of things to think about there. COSH, very useful. And the last one is generally known as power, provision and use of work equipment. And there's regulations about how frequently all your machinery around the organisation needs to be inspected, especially the stuff with the staff, with service users, things that have plugs and cables on it, what you have to look for, and you tend to need a little bit of training in doing that. But once you have training in doing that, then you need to be responsible to make sure that everything's in working order. So you don't use a hairdryer with a service user that's got damaged wire which could short out, go on fire, you know, those sorts of things. Okay, so that brings us to the end of this part of the module. So those of you who are working through the workbook, you can look at questions 6 to 7 now, okay, in the workbook. And again, press pause and do your questions, and I'll see you afterwards. Okay, we're moving on to part 3 now. We're going to look at equality, diversity and inclusion. Although this isn't covered in the assignment, I wanted to put it here so you can go through it at the speed that you want to. But it's just something really important as the introduction to health and social care. It's something you just need to think about, really. It does get picked up a little bit again in our person-centered care unit. So I'm just going to whiz through this fairly quickly. Okay. So promoting equality is really such a large part of your role that you need to sort of think of it on a day-to-day basis, really. So really, the first point, the thing is to make sure that you know what equality, diversity and inclusion means. So it doesn't mean that we are all the same, okay? We are not. We are all unique and different. So a lot of people say, if you say to them, what's equality mean? Oh, yeah, we want to all be treated the same way. Well, we don't actually, because we've all got different needs, wants and desires. So I might want to be treated differently to the way you might want to be treated, because there are some things I might want to do for myself and other things you might want someone else to do for you. So we can take a totally different approach to our lives. So equality is the main role, really. It's about promoting equal rights and equal opportunities. It's about making sure that everybody has equal access to services and equal opportunity to actually do something. So even if I don't want to do it, I need to have the opportunity. We all need to have the same opportunities to do something. I may choose to do it, you may choose not to, but that's different, really. And it's quite a nice definition from Help the Aged here, which is, again, another good website that you can use. Equality means ensuring all individuals, irrespective of their age, have the opportunity to live in the way they choose according to their values, and their different needs, situations, and goals are recognised and respected. And they're treated equally with fairness, dignity, and respect. So it doesn't say we should all be treated the same. It should identify the fact that people have different needs, different wants, different goals, and that they are the things that should be recognised. And diversity goes in hand with that, really. So it's about recognizing that we are all different. We have different perspectives, different ideas, different beliefs, differences to do with our race, nationality, our culture, our status, different levels of ability and disability. And because of that, we are all different. The most important thing is that our differences shouldn't hold us back. So if you put on an event that someone with a physical disability can't get to, then you're not really, approaching equality and diversity in a fair way. Because everyone should be able to have access to your event. Inclusion, about recognizing the differences in society, making proactive efforts to enable individuals to enjoy equal opportunities. So identifying the fact, yet again, that just because someone is different, that they cannot be included into things. And because someone maybe has communication problems, that they get excluded from decision making about their case, or about raising a complaint or a concern, just because it's a difficult process. And we know that we have to, if someone speaks a different language, we need to get a translator, especially if it's preparing their care plan. We might need to use signage, we might need to use pictures, we might need to use a friend who really knows somebody very well to be part of the discussion. And finally, discrimination is about treating certain individuals or groups of individuals in a negative way on the basis of their difference. So again, if someone's got a physical disability, you discriminate against them by not finding a way for them to come into the theatre, because maybe you haven't, the stairs or the doors aren't wide enough and they can't get in their wheelchairs. That is actually discrimination, and now it's covered by law. But there's also negative attitudes, and thinking about some of the language that we use that can be discriminatory. Okay. And sometimes we can be a little bit ignorant about this, but if someone identifies it as discriminatory, then you need to stop and think about, oh, is it? And then have a really good think. It might be something you don't know. And that's okay, because life is a learning experience. A little bit of a note about terminology as well. I've mentioned stereotypes already. And there are also things such as labeling and prejudice. So you can have a think about examples in which ways they can be acted out and seen in health and social care context. I've given you a bit of an example about somebody in a wheelchair not being able to get into the theatre, because people didn't think, well, they have communication problems, they probably won't be able to understand the theatre or something like that. So that's a stereotype. They've got learning disabilities, so they won't be able to do it. There's another classic stereotype. Labeling is something we need to be conscious about, because some people who have a disability don't like to be labelled as being disabled. They might use another term. So nowadays, often people with a hearing impairment prefer to say they're hearing impaired or they're hard of hearing. They don't often like the word deaf. But then there are members of a deaf community who are actually quite happy to use the word deaf and don't like the euphemisms. So what you need to do as part of your duty of care is to get to know the people that you're working with and find out how they feel about the labels that can be used, or maybe try to avoid using those labels in general anyway. As mentioned, stereotyping. Here's a classic example: all older people, or elderly women like knitting or cooking, that sort of thing. Um, or all people with disabilities are in a wheelchair, or all people with learning disabilities can't read or write. Those sorts of things. Very important that you don't resort to stereotyping, because when you're working on someone's care plans, it will shut down and limit the sort of things you think of for them. Prejudice is a little bit more different, and this is something you have to reflect on yourself. If this is, have a look at your attitude really, and that's disliking someone because, well, for any reason really. They don't like where they come from, they don't like what culture they are, they don't like people who are older, they don't like people who are younger, and prejudice is probably one of the hardest things to crack. But when you're working in a team and someone shows a prejudice to either some of your service users or to some of the members of the team, it's always up to you to try and, as part of your duty of care, as a health and social care worker, is to call these sorts of things out, really. You do have to reflect a lot on your sense. You're going to learn a bit about reflection, so try to use reflection, thinking about, should I have said something there? Is that something I should have done something about? And then maybe next time do it, or maybe go up to them afterwards and say, look, you shouldn't really be saying things like that. Have a think about it. And if you're concerned about a person's attitudes, that they're demonstrating clear prejudice, then you need to take it a little bit further to the seniors, team leaders, etc., and ask them to do something about it. In the UK, prejudice falls under discrimination, which is now against the law. So there are some legal controls really on it. So you can't really let things go unchallenged, because they are actually breaking the law nowadays. We've talked a bit about discrimination. Two types of discrimination, really. Direct discrimination, which is pretty obvious. It's deliberate and clear, and people can pick up on it really, really quickly. As in my example, excluding people who use wheelchairs because the doors aren't big enough, or there's too many steps, or there's not a ramp, and things like that. Very direct discrimination. Quite easy to spot and quite easy to report. The more difficult one is indirect discrimination. Sometimes it's unintentional or accidental, and it can be quite hard to spot. So maybe, for example, an organisation that has a policy that excludes some people from applying for jobs for them. Maybe they have to use an online form, and there isn't a way for people who don't have access to computers, or who have some communication issues, like someone has cerebral palsy, um, and they can't always type things out. They might prefer to do a verbal form, or there's all sorts of different ways of doing things now. There's lots and lots of software that can help people. So it's about, or someone who can't drive when maybe the job doesn't day to day need driving. That's one that comes up an awful lot. It's unintentional, because they put in a job description that driving's quite handy, you know. But if someone's really got their heart in this job, they just don't happen to have a driving license, and the job is based in a care home and they don't need a driving license, then they really should not put it on. But it's an indirect discrimination, and really people probably haven't thought it through enough. Two further types of discrimination is something known as failure to make reasonable adjustments. And again, this is the stuff about accessibility. There is an expectation under the law that if someone has mobility impairment, they need to have a reasonable adjustment, which is why you see a lot of disabled parking spaces now near the door. lifts going up into places of work, into big offices and things like that. Um, so that's a failure to make reasonable adjustment, and that can be challenged under law, and it will go to court and decide whether they have made a reasonable effort. If it's going to cost many hundreds of thousands of pounds, they could, if they haven't got the money, they can actually say why. But if it's a very large organisation and they can't really justify it that way, then they should have done it. So these sorts of things will go to court. So one way to reduce discrimination is to be person-centered. We have a whole unit around person-centered care. So I'm not going to go into it in too much detail, but it's just remembering that the person needs to be at the center of your work practice all the time. You need to think about what their aims and aspirations are, what some of the barriers are for them to actually do the things they do. There's no point just setting care plans when you haven't looked at what the barriers are. Is it their physical mobility, and if so, what can you do about it, and then think about how you're going to help someone, and remember that your role is to help them to reach their full potential. And to do that, part of your role is to always work in a non-judgmental way. Don't join in with discriminatory practice. Do not encourage discriminatory practice. Challenge discriminatory practice. And very importantly, keep yourself up to date with training. Your organisation will take responsibility for a certain amount of your training, but it also, as a professional person, it relies on you as well to keep reading, maybe do short courses like the one you're doing now, anything, or just reading up to date articles, get notifications from good websites with new stuff that's coming out all the time. You have a responsibility for your CPD as well. There's quite a lot of legislation. I'm going to flash through this as well. But the main one is the Equalities Act 2010, which you can spend a bit of time looking up. There are some protected characteristics now. It has been reviewed a few times. 2010 was the last time, I think, to cover age, disability, gender reassignment, marriage, civil partnership, pregnancy and maternity, race, religion or belief, sex, and sexual orientation. Other legislation it's important to be aware of is the Human Rights Act. You can look that up, which really talks about everyone's basic entitlement. The Mental Capacity Act, which is important too, it gives you, the professional, a guideline to follow about how to deal with someone who doesn't have the capacity to make their own decisions. You will be working with people like this in the care home, so knowing the local mental capacity legislation, this is the UK Act, where whatever country you're working in will have a similar form of legislation, might have a slightly different title, but you need to make yourself aware of it or find out what the processes are in your organisation for supporting people. And also there is a code of conduct. It's overseen by Skills for Health. It's a code of conduct for social care workers. I've added that to some extra reading for you, so just make yourselves familiar with it. There are lots of different sources of support and advice. You can go to your manager. Your in-house policies and procedures are the first places you look at. Local libraries that help you find out about legislation, and of course the internet, making sure that you're going onto a professional site and not some random site. So be a bit careful. In the UK, we have a Citizens Advice Bureau, but most people tend to go online now, really. Social Care Institute for Excellence is very, very good. That's SCIE, SCI, we call it. They will have pretty much everything you can think of. And also, if you're working with older people, as I said, age concern, those sorts of sites, Help the Aged, are really good and stimulating. Other sources, user-led organisations such as Age Concern, such as MenCap for people with learning disabilities. Law centres, they often create leaflets, which sometimes you can pick up for nothing. An Equality and Human Rights Commission, just go on their website and you'll be able to find out everything you need to know about human rights, and if you wanted to talk about equalities a bit further. I'm going to slip through behaviours that challenges, because you may often come across this as an issue. Whatever group you are working with in the care home, you may have come across behaviours that challenge. You may have already heard that terminology as part of your placement. I just want you to have a look at this sort of poster that was created by Professor Mansell, Professor of Learning Disabilities at the University of Kent. He's an absolute specialist. I sent my staff on his specialist course many years ago now. But he was the go-to man for learning disabilities, and University of Kent still really is great for learning disability research. And it was a statement from Jim Mansell, who said, challenging behaviour says as much about the quality of support a person is receiving as it does about the person. So it's reminding you as workers that challenging behaviour doesn't just come out of the person. It can come out from the support or the lack of support that they're getting, or the type of support that they're getting, can cause that person to challenge. Some different factors cause confrontation. There can be biological reasons. They could be in pain. Their medication can having unusual side effects. They could be ill, in a different way, and not just whatever is the cause of their disability. But it could be, they've got the flu, or it could be they've got a stomach upset and they're trying to deal with it. There may be social factors. They may be feeling lonely, frustrated, especially those people who have communication issues. It can often become challenging if they feel that they're not being heard or not being listened to. Environmental factors. For some people, very loud noises can cause them to sort of have challenging behaviour. Frustration, or if they get restricted in their rooms and they want to get out and about, and if you restrict them too much for no particular reason, that can cause them a great deal of distress, and some people can lash out in that circumstances. Psychological anxieties. Are they feeling excluded? Are they feeling left out? Are they feeling insecure? Are they feeling frightened? So whenever you're dealing with someone who's starting to challenge, you need to break down some of these questions before you really take too much action. Communication is really important. We've talked about that quite a lot. We may need to use pictures. We may need to use signing. You need to pay a lot of attention to their body language and try to find out what it is that might have triggered it, really. And also, your body language needs to be calming, reassuring, so that it doesn't cause them too much distress. You need to talk about issues before they arise. If someone's getting a little tetchy, you might want to talk about it at handover at a team meeting and say that you're concerned. Someone's getting a bit challenging, you're not quite sure what's going on. There might be someone who knows the person better, who can put their finger on it, a key worker. So, communicate is the most important thing. As I said, if someone becomes agitated, be calm. Don't respond in an angry or judgmental way. That will just exacerbate the situation. Encourage them to talk. Don't interrupt them, though. Take on a listening role. Be calming with your body language, but show that you're listening. Take their concerns seriously. Don't laugh or belittle them. And try to talk through the problem together. If you think that your discussion is agitating the situation and making it worse, then remove yourself from the situation. You know, I mean, not rudely, but say, I'm just going to give you some time to, you know, chill out or calm down or relax. And I'm going to come back, or I might actually have to go and get our manager, see if she can help you better. You know, don't say it in a way that they're going to feel threatened, but also say, you know, you're very upset at the moment. I'm not sure if we're getting anywhere, so I'm going to give you a few minutes to calm down. If you remove yourself from the situation and they're on their own, they can possibly calm down. Be aware that there are policies. There may be risk assessments around certain individuals who have challenging behaviour. You need to be aware of what they are. So before you start to work with someone, especially if they have certain challenge risks that challenge, you need to be fully aware of them. You need to have read all their care plans and their risk assessments carefully. If if something happens and if someone does get hurt or something gets damaged as part of it, you'll have to complete an incident form. If someone, you know, does explode or sort of throws cups around the room or slaps somebody, then that all needs to be documented. And you need to identify if anybody has been injured. Obviously, if they need medical assistance, deal with that straight away. Do your report later. On a rare occasion that the police might have to be called if it's very, very serious. Very often you don't in a care home. If it's someone with dementia, it's quite difficult to call the police on them. But it really depends on what your local processes say. And then you write it up. As I said, there will be an incident form. You write it up and sign it and date it, and then be prepared to discuss it afterwards because it will probably get reviewed. You can go over these. You can find out more and more information about challenging behaviour. To be honest, it's a unit all of its own. So, but if you do go on to somewhere like the SCIE website, they have lots of information that can be really, really helpful. And there are books, all sorts. If anybody is particularly interested, you can WhatsApp me and I'll try and send you some stuff. Okay, that brings us to the end of this week's set of slides. You can finish questions 8 or 9 in the workbook now, or you can go back and read any of the issues that you've covered and then complete your workbook at the end, as we said. So for extra reading, I'd like you to have a look at the book chapter that I've put up for you in extra reading, Preparing to Work in Adult Social Care. It's a whole chapter that really, really talks about all aspects of your role as a care worker. Now, you can read it all at once this week, or you can read it across the unit, Justice Unit, over the next 4 weeks. But I would suggest that by the end of this unit, in 4 weeks' time, you should have finished reading that because it gives you all the additional information that you need. There are some quite nice case studies for you to look at, for you to sort of think and, you know, throw some ideas around. It'd be great if you could get together with your fellow students and discuss some of your answers on the case studies. That could be really, really helpful. There is a quiz at the end as well to help you to consolidate your learning and the book chapter. If you're not really clear on the correct answers, if you really think I haven't got a clue what the answer to this one is, then you can WhatsApp me to discuss it or discuss it with your fellow students as well. Okay, so that's the end of week 1, unit 301. Okay, thank you.